Almost 10 years ago, I had my first heart attack when I was 43.
I had a bypass, a valve replacement.
44, I had a second heart attack. 45, I had a third heart attack.
And they literally cut out, I think, about a quarter to a third of my heart that was dead tissue.
4-hour operation went into 8 hours. Then half hour later, it went to another 4 hours because there was some internal bleeding.
It took me 3.5 weeks to actually stand up and get out of the bed.
They feel I can't do this. I have never exercised, I'm overweight, I had a heart attack, I'm just gonna stay home and take my medication.
I was still in recovery and I could barely walk.
I had the drive to get better and wanted to get better, but was deathly afraid of exercising.
Cardiac Rehabilitation is a program for patients with heart disease, and we offer an exercise program, also education.
At first I thought it was just going to be exercise. Well, I can go to a gym and exercise. But no, it's the classes and the care that they provide for you.
Just normal exercises that you'd think nothing of really are fatiguing and taxing on you if you have heart problems.
It's very hard to get into the habit of exercising.
When I first went into cardiac rehab, they have a machine that you row with, and there was probably a 90-year-old lady, if she was a minute on this rowing machine. I thought to myself, well, heck, I can do that.
I remember him telling me, oh, that's nothing.
And when Alicia put me on it, it kicked my rear end.
I'm one of those people, I don't like to exercise. Now they made it a lot easier because, like I said, they made it fun.
This gave me the strength and the confidence to exercise and know that I could push myself without having to worry about expiring.
There's things that you think you know already and you don't.
As a heart patient, you really have to watch what you eat and how much salt you consume.
It's hard to change your eating habits.
I had an incident where I ate some really horrible food during the day because I felt great, and then drank a lot of soda pop because I felt great. Well, that evening I was back in the hospital, and the cardiac nurse read me the riot act.
We always tell our patients you should eat as if your life depends on it, and they do, because it does.
It's hard to change, but because of them, I'm able to make a lot of changes in my life.
I think his biggest obstacle was his stress.
Because I went to work full-time again, and I'm a facility manager, maintenance manager.
He had a lot of stress with work. He was in management, like a lot of our other patients.
Sometimes it could be stressful, my position,
We had to really focus in on his stress management skills and coping mechanisms for him to really realize that he needs to slow down in life with his work and focus more on himself and his children.
Get your family involved in your recovery. Don't shut your family off.
He has 2 kids and 1 grandchild, so he had a lot of motivation.
In the past times when I had heart problems, I used to deal with it by myself. Now I don't.
We encourage them to bring a family member with them, or a close friend or a neighbor, whoever they have, and they can also understand what we do in cardiac rehab, so they can support them and they have a better understanding of what's happening.
It helps you when you share your experience. It makes you understand what happened to you.
My children are they're absolutely amazed.
I went from 225 to 184 right now.
He lost quite a bit of weight.
Since I've been out of the hospital, I've lost approximately 80 pounds.
When you see another new person come in, you want to help them, and you think about it. I remember when I used to be like that.
If there's progress to be made in your health, it could be made there.
These things happen, and there's life afterwards, and there's quality life.